perspective on how this will affect the states and you. Joining us is Democratic Governor Terry McAuliffe of Virginia. He's the chairman of the National Governors Association. Good morning, Governor.
Well, it's great to be back with you.
Okay, you look happy. You woke up today feeling how?
Well, very happy. In fact, I knew for the last couple of days after all the governors met this weekend in Rhode Island that this was a non-starter. This wasn't going to go forward. This would be devastating to the families in our states, devastating to the budgets that we have to administer. So this is a great opportunity. Now they need to come together in a bipartisan way. Exactly what Senator McCain said. I have been arguing for a long time. Let's all get in a room, bring the governors in. We administrate these programs. We run the Medicaid programs in our states. Let's get together in a bipartisan way. This is a major policy initiative. Keep the politics out of it, and let's provide health care for all of our citizens so that we can have a healthy workforce. Today is a great day. The politics is done. They cannot get this through. Let's go back. Do what we should have done day one is fix the things on generic drugs, as you mentioned. There are things we can do when one gets released from a hospital to bundle services, cost savings. There are a lot of things we can do to save money and make sure everybody gets quality health care.
Well, let's pick up on that, Governor, because that would be the flip side, right, which is that today is a terrible day because we have more uncertainty injected into the markets, and the health care providers may spike their rates, and we don't know what's going to happen. And the looming issue, the real concern, is what you just said quickly there, costs. All the governors want more money. They say they need more help to expand Medicaid for the people who need it. But you have this huge constituency within the GOP reasonably saying it costs too much already. So how do you deal with costs and need?
We could literally save billions of dollars in this program. The one thing is give the states, give us flexibility. This is something we've argued. Let us bring our best practices together. But there's billions that we could save in different programs, as I mentioned, on generic drugs we could do in the Medicare program, as well as a post-hospital stay to bundle those services on the Medicare. But remember, on the Medicaid, who are we taking care of? I mean, we're dealing with the elderly, the disabled, pregnant women, and children. Core constituencies of people who need quality health care. The problem you have today is, you're exactly right, it's the uncertainty in the market today. They don't know what's going to happen on the health plans, on cost sharing. They don't know about the subsidies for the individuals. And most importantly, the reinsurance program, which are those plans that take care of the sickest populations of America. We need, on these three areas, to know that the federal government is going to be the partner on these to fund these. And if you bring the governors in who run these programs, we can bring these cost savings to you. But what's happened today, this has all been about politics. We're done with it. The Senate needs to show leadership. Let us come together. Let us fix health care. Let us get infrastructure done. Let us do tax reform. But right now, Washington is ground to a halt. They're letting politics dictate policy. Let's get back what people elected us to do, work together and get things done. The governors do this on a daily basis. The Senate and the House need to do the same thing in Washington.
Governor, what you're saying is Congress, move aside. You can't be trusted to do this. Let us 50 governors come together in a room and we'll get this done. And look, that sounds wonderful. It's music to the ears of anybody who wants a bipartisan solution and effort. But let's face it, what the governor of Nevada wants is different than what the governor of Virginia, yourself, would want. So is it possible you're making it sound a little easier than it would be?
No, first of all, Congress obviously has to do this. But the governor of Nevada, Brian Sandoval, my good friend, we spent the whole weekend talking about health care. Listen, we know we can bring efficiencies to this. But to go in and gut the program and knock all these people, millions of people out of health care, it will raise the premiums. I mean, there's things obviously we need to do. In 2014, when, they first started doing this, they didn't have the claims data. Everybody rushed in. And they figured wrong on a lot of the premium data.
Should you show the savings up front? You think that would help this process? Because they use it. It's such a big stick, Governor, that it's so expensive, that the rates of cost have gone up faster than any of the needs and any of the other indexes. Do you think that there should be some show of potential savings to offset the narrative of cost?
You bet. There's got to be cost savings to it. Listen, Everybody understands that there are things in this bill that we need to fix to make it more cost effective and efficient. We can do that. We run these programs in our states. What Washington does lands on our desk. We administrate these programs. We have all brought efficiencies in our respective states. I wouldn't say get all 50 governors back, but let us be part of the process, the input, so that we can bring what our best practices are. We run these programs, but we have to save money. We have to do it in an efficient way. But at the same time, health care is a right. Everybody's entitled to health care, and we ought to be able to deliver this in a way that everybody gets covered. But to deal and throw our most vulnerable citizens out without health care, and the real winners today are the grassroots activists who have been out there at the town halls and meeting after meeting, letting their legislatures and elected officials know that we will not stand by and allow you to take our health care away. They're the true winners here today. But let's not spike the ball. Nobody should be spiking the ball in the end zone today. This is about what do we do in the next step. And to say we're going to go now for repeal will only bring more uncertainty. Uncertainty is crushing this market because the insurance companies don't know what to do. Continue the cost sharing for the plans. Make sure the subsidies are in place for the individuals. And please continue the reinsurance program for our sickest population. And do not come off the individual mandate. We need everybody in this program for it to be successful, as other nations around the globe have done.
Governor Terry McAuliffe, thank you very much for sharing your perspective on all of this with us. You know, he echoes what we've heard from President Trump at times, which is everybody has to be